everybody. My name is Michaela Antelek, and today I'm going to be talking about Cayuga Counseling Services Outpatient Mental Health Program, which is the agency that I'm currently completing my advanced field practicum at. Cayuga Counseling Services Outpatient Mental Health Program offers therapy services to individuals, couples, and families residing in Cayuga County. Every therapist at the clinic chooses specific interventions based on their client's needs. However, every therapist at our clinic takes a strength-based and person-centered approach to therapy with all of their clients. A strength-based approach is an approach where the therapist takes note of client strengths and incorporates their strengths into their treatment. A person-centered approach is when the therapist meets the client where they are at and makes sure that the client's treatment is designed in collaboration with the client. The most common intervention used at our clinic is cognitive behavioral therapy. For the sake of this assignment, I will be focusing on one diagnosis, how this diagnosis is measured, and how this diagnosis is treated. The most common diagnosis at our clinic is depression, or major depressive disorder. The diagnostic tool used to measure depression at our clinic is the PHQ-9, which stands for Patient Health Questionnaire. This questionnaire has 9 questions on it that screen for symptoms of depression as guided by the DSM-5. The most common intervention to treat depression at our clinic is cognitive behavioral therapy. To make sure that therapists are regularly evaluating their client progress, the PHQ-2, which is essentially a shortened version of the PHQ-9, is embedded into each of the therapist's notes that they must complete at every session with their client. For our literature review, we will be focusing on 2 targets. The first target will be how we measure major depressive disorder, which currently for our clinic is using the PHQ-9 and the PHQ-2 to evaluate and measure for the presence of depression. Our second target is going to be the intervention that our agency most commonly uses to treat major depressive disorder, which at this time is cognitive behavioral therapy. When considering whether or not the PHQ-9 and the PHQ-2 are the best way to measure and evaluate the presence of depression in clients, there are numerous studies that state that there is no significant difference in performance among different depression screening instruments. The 2 sources cited on this slide state just that, and also state that the PHQ-9 is accurate when screening for depression in all age groups, that the PHQ-9 is valid, quick, shorter than other depression rating scales, and can be used in a shorter form such as the PHQ-2 to monitor treatment. The PHQ-9 can also be administered using multiple options, such as in person by the clinician, by telephone, or self-administered by the client. When considering if our agency is using the most effective interventions to treat depression, there were numerous studies that stated that there is significant clinical evidence that CBT and interpersonal therapy, or IPT, are effective in treating depression. More specifically, there was also significant clinical evidence that CBT is effective in maintaining and even preventing depression, making CBT the best option when considering how to treat depression in a client. After conducting my literature review, it is evident that therapists and directors at Cayuga Counseling Services have continuously engaged in research-informed practice to determine current evidence-based methods of treatment, assessment, and evaluation. It is also evident that Cayuga Counseling Services is using appropriate diagnostic tools and interventions to assess for and treat depression. Lastly, it is also evident that Cayuga Counseling Services is doing a good job of monitoring their clients closely in the progress that they make when treating depression, as Cayuga Counseling Services requires every therapist to complete a PHQ-9 with every clinical note completed at sessions. After conducting my literature review, I don't have many recommendations to make for my agency. It is very clear that they are doing a good job of assessing, treating, and evaluating all of their clients that are diagnosed with depression. The only recommendations that I could think to make are that our agency's website is not informational and up to date. This can make it very difficult for clients to determine whether or not they would like to receive services at our agency, as they don't get much information from our website on what services we offer and how to get started with those services. Attached here are my references that I've used in my literature review and a link to my agency's website if anybody would like to know more about my agency. Thank you all for watching, and I hope you have a wonderful day.